Hi guys, Dr. Kid here. In this video, I'm going to go through all you need to know about taking dexamphetamine in the treatment of ADHD. This is going to include how it works, how to take it for the best effect, and what are some of the key side effects to look out for. So what is dexamphetamine? Well, dexamphetamine is a short-acting stimulant medication that's used to treat the symptoms of ADHD. Patients with ADHD often suffer from executive dysfunction, and this could include symptoms such as poor organization, poor attention, poor concentration, and emotional dysregulation. The issue in ADHD is thought to arise from an area of the brain known as the prefrontal cortex, which is an area at the front of the brain. And this is the area of the brain that is responsible for executive functioning. The way dexamphetamine helps patients with ADHD is that it increases two chemicals, noradrenaline and dopamine, in the prefrontal cortex. So how do you take dexamphetamine? Well, the most common way I use dexamphetamine is actually as an adjunct to the long-acting version, Dexamfetamine or Vyvanse, which is the common brand name. Usually with Vyvanse, when you take this as a medication, some patients experience a crash early in the afternoon, maybe around 1 or 2 o'clock, as the effect of the medication has not lasted long enough. This is where I find dexamphetamine can be quite helpful. You can take one around that 1 or 2 o'clock crash, and this can help tide the patient over a bit longer and avoid the symptoms of the crash. Dexamphetamine can also be taken as a solo agent to treat ADHD. It comes in 5 milligram tablets and can be taken up to 40 milligrams a day as needed. This would be equivalent to 8 tablets a day. For the average person, dexamphetamine lasts 4 to 6 hours. This is why when dexamphetamine is taken as a solo agent, it's typically taken with a twice a day dosing, once in the morning and then another tablet 4 to 6 hours later. How you would normally take it is that you would start with 1 tablet twice a day, and if you felt there was no effect and no side effects, you could increase by 1 tablet for each of those times until you get the desired dose to a maximum of 4 tablets twice a day. However, because dexamphetamine is short-acting, I have seen a wide range of ways that it's been taken. Some examples include some patients I've seen take 2 tablets 3 times a day. I've seen some university students only take it during university study and not take it during university break. I've seen some patients only take it 5 days a week during their workday and not take it on the weekends. So it is very flexible and it can be adapted to your lifestyle. One thing I will say about dexamphetamine is that you can build tolerance quite quickly and it can be a little bit more addictive as compared to the other stimulant medications that I use for ADHD. Therefore, I'm just extra cautious when I'm using dexamphetamine as a solo agent to treat ADHD. By the way guys, if you're finding this information helpful, don't forget to like and subscribe to the channel. It'll really help me out a lot. So what are the most common side effects of dexamphetamine? Well, the most common side effects include headache, dry mouth, reduced appetite, effect on sleep, weight loss, and palpitations. So what are some of the rarer but more serious side effects that you can see with dexamphetamine? Well, some of the potential side effects of dexamphetamine can include heart attack, stroke, precipitation of psychosis. That's why you have to be careful in patients with a history of bipolar or schizophrenia, worsening of tic disorders or Tourette syndrome, worsening of seizures, and you can see growth suppression when it's used in children. Another thing to be aware of when taking dexamphetamine is that it's recommended to have regular monitoring with your doctor. This is the same with all stimulant medication for ADHD. This monitoring includes things like measuring your blood pressure regularly. This is because high blood pressure predisposes to conditions such as heart attack and stroke, and you have to be very careful using dexamphetamine in these patients. Another thing to monitor is your weight. Dexamphetamine can reduce appetite quite significantly in some patients, and this can lead to an unhealthy level of weight loss. Additional monitoring includes regular blood tests, which can include full blood count, kidney function, liver function, and thyroid function blood tests, and also an electrocardiogram or an ECG. This is a test where there's some leads that are placed on the chest, and this looks at the electrical activity of the heart. This will help us detect if there's any abnormal rhythms or heart problems that are being caused by the dexamphetamine medication. So that's my summary of dexamphetamine for ADHD. If you think this is the medication for you, please see your doctor for your specific case. If you're interested in other ADHD medication, see the links in the description below. I'll link the other videos I've done for other stimulant medication. I'll leave here the video that I've done for the long-acting version of dexamphetamine, and I'll see you in the next video.